As the first Central Floridians receive coronavirus vaccines this week, there are some questions as to how it will actually work when it comes to stopping the spread and ending the pandemic.
Kirsten O'Connor is off, so Bridget Ellison is standing by now to ask a doctor.
Ask a Doctor is sponsored by Conviva Primary Care for Seniors.
You've probably heard the term herd immunity by now, and we know immunity means good things for stopping the spread, but how does it work? We're asking Dr. Jeffrey Stalnaker, the Chief Clinical Officer of Health First, to explain.
The short answer is if enough people are immune to a virus, then it can no longer effectively spread. Typically, viruses don't go away because they mutate and they don't become infectious anymore. Generally, the virus doesn't change. The only way for it to go away is it just no longer has a host that it can live within. And outside of a host, like a human, they don't survive very long.
Well, the next question is, if you get the vaccine, can you still be a host? Dr. Stalnaker says, as of now, we know it's effective in preventing you from getting the disease, but it hasn't been able to have been studied long enough to tell if you'd still be able to spread it. But we do know is that a vaccine is still key in stopping the spread.
Coronavirus is also a fairly infectious virus, maybe twice as infectious, for example, as influenza. So it spreads more rapidly. And with coronavirus, roughly, if you don't do anything different, for each person on average that's infected with it, they tend to infect 3 others. So 3 becomes 9, becomes 27. So that's where you get that exponential spread in a community. So the way to ultimately make a pandemic go away is you have to get enough people who are immune to it that it no longer spreads from 1 to 3. In fact, I can't spread it to anybody because everybody around me's already had it. So for coronavirus, that number is estimated to be maybe about 70% of the population. So if roughly 70% of us are immune to it, then it will sort of exponentially go in the other direction and disappear.
And that's where the vaccine comes in to help spread the immunity, because Dr. Stalnaker says the only other option is everybody becomes infected, and that's too costly. He says although some are worried about the vaccine, he believes it, bottom line, is the solution that will help get us closer to back to normal.
I know, people are obviously going to be skeptical, many people at first, about anything, any kind of medication that I prescribe in the office. People are initially skeptical, and we have to talk about it, and we have to weigh the risks and the rewards of what we're doing. So I think it'll be the same with this, but with the sort of devastating effect that coronavirus has had here and around the world, I think we'll reach a tipping point on that much sooner.
And if you're interested in learning more about the COVID vaccines, we have all that information right now on clickorlando.com. You can find out the general timeline as well on how we expect them to be given out.